Hey guys, and welcome back to my channel. If you are new to my channel, welcome. My name is Karen. I'm an LPN student. I'm in nursing school, actually in my second quarter of nursing school. And today's video, I'm going to be talking about how I studied and passed pharmacology. If you guys are not familiar with pharmacology, it's basically the study of drugs, what these drugs do to the body, how the body reacts to these drugs.
And a lot of people will say, oh, it's all about memorization.
But honestly, nothing beats really understanding the concepts and why you're giving these drugs, the side effects of these drugs. It'll help you understand the drugs a lot better than just trying to memorize. Like, there are so many drugs that you cannot just sit there and try and memorize and make mnemonics for everything.
I mean, that does help, and I'll get into that in a little bit.
But for the most part, like, you really want to familiarize yourself with anatomy, pathophysiology, because you really need to understand how the body works and know a little bit more about these diseases. So again, if you guys don't have any type of background in these classes, I highly suggest that you guys take them before you look into pharmacology. So what I did prior to starting my pharmacology class, I just got familiar with the drugs that I had at home, like over-the-counter drugs and prescription drugs. As you guys know, my son, he does have special needs. He actually went through like 5 prescribed medications since he was born. Right now, he's only on 1.
So I actually had the exposure to some of these drugs that we went over while we were in class. So that kind of gave me like a sense of leverage when it came to studying the material, understanding what the purpose of these drugs are, their side effects, their interactions, who can take this, who cannot.
So if you just go through like your medicine cabinet and you just pull a couple drugs and just get yourself familiar with them and maybe look them up if needed.
Again, you have to really be in it to win it to pass this class.
And this was a way to get started. All right, so now on to how I study for pharmacology. So this is the textbook that we use for my class, and I'm going to show you guys how I pull information from it. Now, before I show you guys how I highlight and pull information together from my notes, I'm going to show you guys what I do first and foremost. So whenever I'm assigned a chapter, I make sure that I go through that chapter right away. But when it comes to these long chapters, what I would do is I would split up my chapter by sections, or just split up the chapter however you want. But I find if I just go through one segment a day or maybe 2 segments a day,
it'll just help really absorb the information.
I have a chapter here. This is central and peripheral nervous system medications. So I would study by class of these drugs. Like, for example, we have anti-migraine agents, we have anti-epileptic, anti-Parkinsonian, anti-anxiety agents, antidepressants. So what I would do is I would literally just split up each section by the class of drugs.
Now, before I show you guys how I highlight and actually pull information from the textbook,
I highly recommend that you guys go to the ATI website and download this medication template. While you're reading through the textbook and you're going section by section, jot down the drugs that you are coming across. But at least you have a mental note, and you could fill this out later once you're done with the chapter. So now I started highlighting, and I have different highlighters here, different pens here. But for the drugs, I highlight them in one color, what they do in another color, the nurse interventions in another color, any precautions that you should take that definitely stand out to me, I'll highlight them in one color. And definitely anything that the patient should know, like client teaching, I highlight it in red. Highlighting in different colors definitely helps me do my note-taking outlines, and also when I'm filling out the medication template itself, it helps me remember where to put what. So yeah, I would keep that in mind while I'm going through my text. I would suggest that you guys, when you're in class, that you ask your professor, which drugs do you really need to know? Start making your medication templates so that way all the information is there. I don't expect to like do every single drug. As you guys can see, I already had a lesson on this. So I circled the drugs that I needed to know, and I did make medication cards for them. Again, like you guys will see, pretty much this is how my medication sheet came out. Usually I type this up, but I just wanted to show you guys an example because I have so many of them. Also, what I like to do is at the end of the template, I'll put other medications that are similar to this medication, so I just keep that in mind. As I'm going through my test, I'll realize like, okay, this is a drug that's associated with this medication. I was going to tell you guys, mnemonics also help. As you guys can see, PAM and PAM, those are benzos. You'll learn these things when you're in pharmacology. And also, you know, keep in mind when you're filling these out, you want to put what type of body system is associated. And I'll definitely go down a list of different tabs that you guys should make just so you can have all your drugs in their correct spot. You don't necessarily have to go off of the classifications. I like to organize how it affects the body. So these are drugs that affect the nervous system. So I'm going to put them in blue and I'm going to write NS whenever I fill out my template.
Alright guys, so this is the template from ATI, the medication template.
And I will leave a link to this below. But I just wanted to go over this with you guys so that way you know how to fill it out. All right, to start off with the medication, you want to make sure that you put the generic name as well as the brand name, because some professors, even patients, clients, they will refer to the trade name. You really need to know the generic name of these drugs because this is what's going to be on the NCLEX. You also want to make note of the drug classification of this drug. What type of drug is it? Is it an anti-anxiety drug? Is it an anti-epileptic drug? You'll understand it once you get into pharmacology, but you want to make sure that you put the drug classification. Also, and it's not shown here, but I have it here for an already filled out template, but I would put the body system that's associated with this drug. So for this one, this is a Xanax. This was a nervous system medication. So what I would do is when I'm filling out these med templates, I would put that in the corner there, and that's how I would organize my binder. Now on to the next section, the purpose of the medication. You want to know what the motive of this drug is, the types of disorders that this drug treats, the complications, medication administration, that's the dosage, the route that it's given, if it's given by mouth or IV. If it's for an adult or child, you definitely want to make sure that you put the right dosage amount and the time that it's given, if it's given in the mornings, at night, you know, how often. For contraindications, precautions, you want to make note of who should not be using this drug, like if they're pregnant, if someone is breastfeeding, precautions if they're elderly, or if they had liver disease, or anything that will increase if they take this drug. As for precautions, maybe it's an older adult that you need to watch out for while taking this drug. If they had liver disease or any complications that will increase if they are on this drug. As far as interactions, you need to know which drugs this medication interacts with.
An increase in effects, like if you have great food, that will usually increase the effects of this drug, and that's usually not a good thing.
When it comes to nursing interventions, these are just steps that you take as a nurse, and you just want to make sure that you're promoting safe use of this drug. If there's any labs that you need to monitor for this patient. For client education, where you're teaching the patient what they should keep in mind, that they should avoid using certain mechanics like driving if they're on a certain drug, especially a sedation drug. They should notify the provider if they experience any type of effects that you don't see normal. As for the evaluation of medication effectiveness, this is pretty straightforward. You just want to know that this drug is working, you know, what to look out for, the expectancy to look out for, the benefits, if it's 1 to 6 weeks. You know, some drugs, they do take some time, so you just want to make sure that you write all of that information here. Alright, so here's a list of how I'm going to set up my dividers, and I will definitely leave this in my description box if you guys want to make a similar list. Pretty much give you an example of each one. I'm not going to run through it right now because it's a lot to say, but I'll leave this below so that way you guys know how to set up your binder. So I am setting up my dividers right now. As far as like resources outside of my textbook, I really didn't use too many. I used like YouTube videos like SpeedPharmacology.
There's a couple that I use, maybe like on hand, maybe like 2 or 3.
And I'll leave the links below. But I did use Pinterest. I did go on there for a few things. I did find a couple mnemonics, but like Picmonic and what is the other one, Sketchy Farm or something like that, I didn't use those because number one, I am so broke, so I wasn't trying to pay like $20 a month, but I heard it's very useful. But like I said, I did use Pinterest and I found a couple mnemonics on there. You'll be surprised, people actually upload images to Pinterest, so you might want to check there first. Another thing that I suggest you guys get is a pocket drug book, and honestly this will help you in clinicals as well. And that's another thing, in clinicals, while I was doing report, I would see what type of medications my patient was on, and then while I'm going through the report, I would actually make like a mental note or just write it down in my notebook, the type of drugs that I'm coming across, and then I would look them up later, or as I go and as I do a care plan, I would kind of see like what these drugs are about. So that's another thing where you guys definitely should get yourself a pocket drug guide, and I got this off of Amazon, and I'll leave a link below. Alright, to wrap up this video, I just want to stress to you guys, pharmacology is not something that you learn in a day. It definitely takes time. You really need to sit down and read through your text. Make sure that you are making your med templates, and it actually helps to go over these things with a classmate. Get yourself familiar with Quizlet, make flashcards, test yourself, listen to your flashcards as you're driving to school or whenever you're bored, or just like throughout your day when you come home. You just want to make sure that you keep in mind that repetition is key. Just be about pharmacology. I don't know, that's the best way to put it. Especially in clinical, you want to make sure that you keep your drug guide by you and you get familiar with the drugs that you come across while you're in clinical. I feel like it will help because at least you'll see your patient and you'll kind of get familiar with like the symptoms and how they react to these drugs.
How I can put it, I don't know how else I can say it. I'm hoping that this video helped you guys.
If you guys have any suggestions or any questions, definitely leave them below. If you like this video, definitely give it a thumbs up. If you guys would like to see more videos like this, and definitely follow me on my nursing journey, you can hit that subscribe button. Definitely keep that notification bell on so that way you know when I've uploaded a video.
And hopefully I'll be able to pull out more videos this week. So yeah, alright guys, take care.